Hi, I'm Melissa Coll, and this is Ann Cooney. We're social workers with the ALS Association Greater Philadelphia chapter. And today we're going to be discussing financial considerations and insurance when considering being trached and vented. So when someone is trached and vented, they require 24/7 care. And this means that they need someone physically with them 24/7 at all times in order to be able to address any issues with the ventilator or if the monitor were to go off or anything. They need to be right there to help them. So obviously that would be extremely difficult and impossible for one person to do that and be available and awake 24/7. So we wanted to discuss how you can get care in the home and what that looks like when someone is on a ventilator and trached. Typically, we recommend that you have 3 to 5 people in your circle that are trained in vent care, and that doesn't just mean it has to be a nurse. It can be any family member or friends. Anyone is able to be trained in the care. The reality is that insurance does not cover this care at home long term. So even though you really need 24/7 care, it's not a benefit that is covered. Medicare does not cover ongoing 24/7 care in the home, and most insurances follow the Medicare guidelines. There are some exceptions to this and some plans that cover care in the home, but it's very rare. So looking at the typical timeline when someone is trached and vented, typically they're in the hospital for that procedure. They would also receive a PEG tube if they don't have that already at that time. And then from the hospital stay, most often people are transferred to an LTAC unit, which is a long-term acute care hospital setting for further adjustment to the trach and vent settings as well as for family teaching. And from there, they're discharged to home. So the big question is, how do families do this? And typically, most families that we see that are home on the trach and vent have a real mix of care in the home, from private duty nursing, family and friends, and the limited insurance support as well in the very beginning when someone is first discharged home. So when you're looking at private duty nursing, the average, if you were to hire someone through an agency, the average cost is about $50 an hour. That's for an LPN that's trained in vent care. Now, a home health aide, which a lot of people have prior to being on a vent, that typical cost through an agency is about $20 to $30 an hour. However, home health aides through an agency, due to liability, are not allowed to do vent and trach care. So it would have to be a nurse that's at least an LPN level. And they start at about $50 an hour. We did some math, and there are studies out there, they're somewhat dated, but if you're looking at $50 an hour for 27 care, if you're paying out of pocket, that's on average about $438,000 a year, which obviously is astronomical. So how do you find care? This definitely seems to be the biggest challenge for our families that have a loved one that's trached and vented at home, is the availability of vent-trained nurses. And that's why we always encourage that people have family members and friends trained as well for backup, because you never know what could happen. If even a nurse on her way could get a flat tire and isn't able to get there to relieve the next person. You always have to have a backup plan B and plan C. So how do we find care? Agencies that have vent-trained nurses, training family members and friends, again, as backup support. And then there's always out-of-box ideas that we encourage. There are websites to hire, such as care.com. Word of mouth, even within your community, if you know a family or friend that had someone cared for, that had one of their loved ones cared for, if they come with a good recommendation. A lot of times people will look at local hospital, like training hospitals, teaching hospitals or universities that have a nursing, respiratory, or physical and occupational therapy program, and they hire students. And this may be a way economically to save some money and not have to start at that $50 an hour cost. And you would teach them and train them in the care. Also, your local church or synagogue, they often have outreach programs, and they may be aware of caregivers in the local community, as well as your local senior center. They all may be resources to look to see if there are caregivers available in your community that are looking for work or willing to be trained in this type of care. Okay, Anne is going to address the veterans benefits and the waiver programs.
Thank you. So if you're a veteran and you've been deemed 100% service connected due to your ALS diagnosis, the VA does provide support and care for you to be either home on a ventilator or in a nursing facility on a ventilator. They provide at home 28 hours of home nursing per week. Home nursing means RN or LPN care, and they use contracted agencies to hire these nurses to come out and provide care. They do not provide any home health aid support with this program because all the hours are dedicated for nursing care. If you find that you need additional support through home health aides, you can apply for another program through the VA called the Caregiver Program / Veteran Directed Program. If you're approved, you can receive more money a month, more compensation to then go ahead and hire additional home health aid support in the home. Connecting with your VA team, your clinic team to learn how to apply for this program is what you should do, and they will help you guide you through this process. If you're unable to be at home for whatever reason, then the VA can support your care in a nursing facility. They have contracts with local nursing homes all around our area where they would pay for you to reside there in the home, care provided for you there, and the VA covers that cost. The monthly compensation that you have been receiving prior to being placed in a nursing home would decrease once you enter the nursing home because now a lot of the funding is going to the nursing facility for your care. You would still receive compensation, but it would be at a lower rate. And again, your VA team could help guide you with that whole process and explain all of the particulars surrounding that. The one thing I think we've all kind of touched on is, whether, being at home through the VA or through the other program that I'm going to mention is staffing can still be an issue. Finding RNs and LPNs who are trained with vent care experience can be challenging depending on where you live. If you're in a more rural area, that always presents a much bigger task in finding these nurses. But we'll work extremely hard to try and find the caregivers that you need to be at home. The other program that offers support is called the Medicaid Waiver Program. This program was created as a way to provide people the opportunity to still remain in their own homes but receive nursing home level of care. So hence the word waiver, kind of waiving the nursing home to be at home for the care that you receive there. To be eligible for the Medicaid Waiver Program, you need to be financially eligible for Medicaid and eligible for Medicare. Our chapter, serves the Pennsylvania, New Jersey, and Delaware, the entire state of Delaware. So each state offers waiver programs, but each state kind of administers it differently. So one state may offer one form, another state may offer something different. So you need to really check in with the people that you're working through to apply for these programs to understand what would be applicable to you. The waiver program is based on income and assets, and again, every state has different guidelines, but if you fall within those guidelines, then you can be eligible for care within your own home. And what that means is they would provide basic home health aides, caregivers to help you with your personal care, but also depending on where you live, you may be eligible to have skilled caregivers coming in, meaning RNs and LPNs that can manage the trach and vent care needs, the suctioning, trach, changing, the peg tube feedings. In certain areas, you can have those types of caregivers coming in to provide that care. And it is all being covered through the waiver program, so there's no money coming out of your own pocket for that type of service. Sometimes people with the home health aid component can have aides coming in up to 40 to 50 hours a week. It just depends on your need, and it depends on what they're able to provide. And again, staffing, finding caregivers, consistent caregivers, tends to be a growing trend with some difficulties regarding that. But hopefully Hopefully we're going to come out of this COVID era and all those things are going to improve some, and that will be a very good thing. Let's see. If for some reason you can't be in your own home and nursing home placement is required, then you can go to a specialized nursing home that provides vent care. There is some Medicare coverage for that. Typically, they'll cover for about 3 months' time, and then after that 3-month time period, the Medicare coverage would stop, and at that point, you would either pay privately to the nursing home, or if you're eligible for Medicaid, you would apply for what we call a nursing home grant that would cover your stay in the nursing home. So nursing home, placement is an option. It's a little bit more challenging because you need to find a facility that can handle a vent patient, but those facilities are there. Excuse me. Another thing, in trying to navigate all of this, many of our families seek the advice and support of an elder care attorney to help them understand the resources that they have and how they can maximize these resources and kind of figure out how they can manage this type of care, whether it would be at home or in a nursing home, kind of trying to maintain the assets that they have as well. So it's always a very good idea to consult with an elder care attorney because they can really guide you as to how you can manage this process best. We hope that this has been helpful in understanding the needs of patients who require non-invasive and invasive mechanical ventilation, being prepared to provide this care, good communication with your families, knowing what your wishes are from the beginning, and kind of having these conversations as you go throughout your ALS journey are so important to, I think, determine that you get the care that you want to have. You're in control. We stated earlier, just the consistent communication will encourage more positive experiences, and we, as your chapter social workers, are here to help you through this process, answer your questions, and support you every step of the way. So thank you so much for listening with us today.